It's now my pleasure to introduce to you Dr. Gillian Barclay, who is a member of the Roundtable and I think a real pioneer in instigating our Roundtable to focus on the issue of digital technologies and health disparities. She's Vice President of the Aetna Foundation. In her role there, she leads the development and evaluation of the Foundation's national and international grant programs and cultivates new projects within its 3 focus areas. Gillian also has a strong Michigan roots, having earned her doctorate at dental surgery here at UDM Mercy and an MPH from the University of Michigan, as well as a PhD from Harvard. Dr. Barclay is a passionate advocate for advancing health equity. Importantly, she has worked as a consultant with tech companies to see how health could be integrated into technology, being the first public health grad in the U.S. with some dissertation research in the area almost 20 years ago. She has led the design and implementation of the first major philanthropic health initiative in the U.S. on this topic, and she tells me she has rightfully owned the titles of Dr. Microchip and Dr. Smartphone. Gillian.
Good morning, everyone. Good morning once again. I'm absolutely excited to see this workshop finally come to fulfillment, finally happening. And on behalf of the chair of the board of the Aetna Foundation, Mr. Bertolini, Mark Bertolini, who is actually a graduate of Wayne State University, the native Detroiter, it's our pleasure to also support this workshop and the work of the IOM Roundtable. I'd like to acknowledge some of the Aetna Foundation staff who are here in the audience. If you could just stand, please. So, that's Elise and Anisha. Please feel free to chat with them, connect with them if you have any ideas. And also Ace, who is outside assisting our colleagues from the Institute of Medicine. So I will actually take the time to introduce our keynote speakers. We have 2 amazing keynote speakers for you today. First speaker is Dr. Kimberly Dawn Wisdom, who is the Senior Vice President of Community Health and Equity and Chief Wellness and Diversity Officer at Henry Ford Health System. Dr. Wisdom is a board-certified emergency medicine physician and chair of the Gail and Lewis Warden Endowment on Multicultural Health, and Michigan's and the nation's first state-level Surgeon General. In 2012, she was appointed by President Obama to serve on the advisory group on prevention, health promotion, and integrative and public health. And since 1987, she's been on the faculty of the University of Michigan Medical School's Department of Medical Education and adjunct professor in the U of M School of Public Health. Go Wolverines. Now, Dr. Wisdom founded the award-winning African American Initiative for Male Health Improvement, and most recently, the Women Inspired Neighborhood, or WIN network, which aims to improve access to health care and reduce infant mortality in neighborhoods in Detroit. So I will spend some time now introducing Dr. Nilsson. Is Dr. Nilsson here yet? Or she hasn't? Oh, not yet. I think slightly delayed, but I will still go ahead and introduce her. Dr. Nilsson, Wendy Nilsson, is the Health Science Administrator at the NIH Office of Behavioral and Social Sciences Research and the Program Director for the Smart and Connected Health Program at NSF. Wendy's scientific focus is on the science of human behavior and behavior change, utilizing technology to better understand and to improve health, adherence, and mechanisms of behavior change and behavioral interventions in complex patients in primary care. Wendy is actually a pioneer in really advancing a lot of the research in M-Health that we see coming out of the National Institutes of Health. So I would like to take it's my pleasure now to introduce Dr. Wisdom, who is going to share some words of wisdom with us in this area.